We all want to be great physical therapists and help our patients reach their goals. Most of the time, however, a patient doesn't walk through the door saying one of their goals is to prevent sudden death, and yet that should be one of our primary goals for every patient. Let's talk about that. The most common causes of sudden death in a physical therapy clinic are cardiovascular events like strokes, heart attacks, and things like that. While we do certainly have a long-term role in preventing these things with exercise, nutrition, stress management, etc., we often overlook our most critical piece of prevention, and we'll talk about that right now. To help frame the discussion, let's start by asking a very simple question. What is normal blood pressure? Almost immediately you think, well, it's 120/80, and you're right. But let's change the question just a little bit and ask, what is normal blood pressure after exercise? If your answer wasn't as quick this time, you're not alone. Although we regularly, routinely take blood pressure before exercise in physical therapy, it is extremely rare that we see physical therapists routinely taking blood pressure after exercise. Based on ACSM guidelines, any patient whose systolic blood pressure exceeds 250 millimeters of mercury needs to immediately stop exercise. Similarly, anyone whose diastolic blood pressure exceeds 115 millimeters of mercury needs to stop exercise as well. Finally, if systolic blood pressure drops more than 10 millimeters of mercury, that's another cause to stop exercise. The reason to stop? To prevent sudden death. The most important question to ask in this entire discussion is how will you actually know if your patients reach any of these stopping thresholds if you're not taking blood pressure after exercise? We all want our patients to reach their goals. Hopefully after this discussion, you will add the goal of preventing sudden death for every one of your patients by doing at least one check of blood pressure after exercise. For every patient, regardless of who they are, you go a long way to helping them survive longer.